Very good. So welcome. I'm Mike Crowley. I'm the CEO for the National Kidney Foundation of Wisconsin, and I'd like to thank you all for joining us this evening. We have some great speakers, great presentation, but most of all, we have fun with this. We learn and we have some fun. So I've been with the National Kidney Foundation of Wisconsin for now into my 8th week. Very proud to lead this organization. Next, I would like to share a new introduction. Sue Jelson, she is our Director of Community Outreach. She started just over 2 weeks ago. She comes from the American Diabetes Association and also a Juvenile Diabetes Research Foundation volunteer. Her and I go way back many years working with Juvenile Diabetes Research Foundation as volunteers, and both with children that have type 1 diabetes. So Sue comes to us with a lot of passion for helping people, helping families, and I'll let you say a few words, Sue.
Oh, thank you. Hi, everybody. That's probably my biggest message, is that I definitely feel very passionate about helping people and helping them to find the answers that they need when they need them most. So I am learning a lot in my first couple of weeks, and just amazed at the work that goes on within the National Kidney Foundation of Wisconsin. I'm very excited to work with all of you in the community, to work with the healthcare community, and to just keep moving forward and keep doing what we can do to make sure that people understand what we do, as well as, keep moving forward on organ donation and all the things that are so just very important that people don't even know that they need sometimes. So thank you to all of you.
Thank you, Sue. And officially welcome. Tonight, our agenda is we have our introduction, of course, and Michelle and Jill will help facilitate the program. We have an advocacy update. We have some other items to share, an infomercial on ourselves, and then a closing. Next slide. So a few housekeeping things. During the meeting, if you click on the participants on the lower portion of your screen, you'll see the first and last names are displayed. If not, rename yourself to the name you used when you registered. And next slide. So there you can see where participants are on the bottom of your screen. There's 11 right now that are joining us. If you have any questions, you should keep yourselves muted. So click on the mute button unless you're ready to speak or you're called on. Use the in-meeting chat to ask any questions of the moderator or the group, to comment or share your experiences. We encourage this so we don't interrupt the speaker, but as the questions pop up, we'll try to get those questions answered or at the end of the presentation. And then use the microphone icon at the bottom left of your screen to unmute, and then mute your microphone. And then the video, use the video icon next to the microphone icon to stop your live stream image being shown on the video screen. We like to see you during the presentation, but you're welcome to turn the video off. As we are in a virtual world, sometimes you get tired of staring at the screen and you just need a break, but we do like to see your smiling face and interact with you. So we want you to have the National Kidney Foundation of Wisconsin be your charity of choice. Amazon will make a donation every time that you use the Amazon Smile.com link instead of just Amazon. So visit smile.amazon.com and select National Kidney Foundation of Wisconsin. If you have a car that you'd like to donate, or you know somebody, encourage them to go to kidneycars.org, easy to remember, easy to get rid of your headache, easy to donate, and really helps us with our funds to continue the programming and research. And then make us part of your social network. So we are on all of the platforms for social media, so please visit those, especially YouTube. There's a lot of past history and videos to watch. We have our Capital City 5K run, walk, and possibly bike ride on Saturday, July 31st, 2021. Last year, it was a virtual event. This year, it will be a virtual event as well. It was very successful last year, and we hope to continue that success this year. Our Living Donors Together co-chairs this evening are Michelle Sherman and Jill Dillon, and I will pass this on to Jill. Welcome, Jill.
Thank you, Mike. So welcome to everybody. Michelle and I actually a few years ago got together with the National Kidney Foundation of Wisconsin and formed Living Donors Together of Wisconsin. And you can join us actually on our Facebook page if you haven't already at Living Donors Together of Wisconsin. And we've been able to, along with the National Kidney Foundation of Wisconsin, been able to run several of these type of webinars and different events, set up a booth at the 5K that Mike was just talking about, and really just kind of had a lot of opportunities, fortunately for us, to be able to spread the word about living donations. So we're so glad that you've joined us. We're glad that for the people that have joined us in the past. We welcome any ideas. If anybody has any ideas about potential programs in the future or things that you want to know more about, speakers that may be interested in joining us, please just reach out to us on our Facebook page. We're more than happy to talk to you about ideas. We run out of them ourselves, so we're more than happy to talk to you about that. But welcome tonight, and without further ado, I want to turn it over to Sarah Hicklin, and Sarah is going to talk about advocacy tonight.
Thanks, Jill, and good evening, everybody. My role in this group is to share advocacy updates because I serve on the Kidney Advocacy Committee of the National Kidney Foundation. The Kidney Advocacy Committee, which is quite a mouthful, we're quite busy at the beginning of this month. We had our 8th annual Kidney Patient Summit held virtually with our federal legislators. I'll share more about this event in a minute. I joined the Kidney Advocacy Committee shortly before my transplant in August of 2018 because I had previous experience with grassroots advocacy, and I'm passionate about discussing legislation related to kidney health, treating kidney disease, and issues related to transplant and dialysis for those in end-stage renal disease. I needed a kidney transplant because my family has a genetic kidney disease called polycystic kidney disease, and I'm the youngest of 3 siblings who were affected by this disease. All 3 of us are post-transplant and doing very well. We are all extremely fortunate to have received preemptive transplants, meaning that none of us were on dialysis at the time that we received our transplants. And then on this slide, you can see what happened at the 2021 Patient Summit. We had over 230 advocates like myself from across the country. This happened 2 weeks ago on March 2nd. I took the day off from work so that I could meet virtually with our federal legislators' offices, along with a team of fellow Wisconsinites, to talk to about some legislative issues and other asks. The picture on this slide shows the 4 of us: Jane Carter in the upper left, Mary Balaker in the upper right, me in the lower left, and Cherie Link in the lower right. We had a great mix of experiences on this team. Jane is a 2-time transplant recipient due to complications of diabetes, but lost both grafts and is now back on dialysis and plans on being on dialysis for the rest of her life. Mary had a kidney disease that affected her beginning in childhood, and she's been on dialysis off and on, and is a 4-time kidney transplant recipient. Her first living donor was her brother, who lost his job when he donated over 20 years ago. So you can imagine that she is also very passionate about the Living Donor Protection Act, which I'll talk about in a minute. And then Cherie Link is a living donor, and I've encouraged her. I just met her for the first time, so I've encouraged her to join this group, and hopefully we'll be hearing from her. As you can see by the list, we had meetings with 5 of the 10 offices. We have 2 senators for Wisconsin and then 8 representatives in the House. And we were able to meet with 5 of those offices. We didn't have the member of Congress themselves in our meetings, but we did meet with staff who are responsible for healthcare legislation. If we could get Kidney Advocacy Committee members from the other House districts, it would be easier to get meetings with those offices. So if anybody on this call or listening to this later shares my passion, please reach out to me, and we would love to get more advocates involved throughout the state of Wisconsin so that we have all of our districts represented. Each meeting is scheduled for about 15 minutes. Sometimes they go a little bit longer if the staffer allows us to go longer. So the participants share a very brief version of their story, generally no longer than 2 to 3 minutes. And then we ask for the support that we need. And the next 2 slides are going to show some of the things that we talked about. So if you could advance to the next slide, please. Thank you. National Kidney Foundation has been working on a version of the Living Donor Protection Act for a number of years. There are quite a few individual states that have adopted a version of this law, but we don't yet have a federal law. And basically, the Living Donor Protection Act would provide FMLA type, family medical leave type protections for living donors, because there have been donors who have reported issues with either getting health insurance or life insurance, or having trouble renewing their insurance and getting increased rates. And also people that have trouble with their employment as a result of being a living donor. None of the people in this group that I've talked to has had those issues, but they are still being reported. So the Living Donor Protection Act, if we can get that on a federal level, would offer these protections. And these 2 bills were just reintroduced since we have a brand new Congress. And the bill numbers are Senate 377 and House 1255. So we asked for people who had already co-sponsored this bill in the previous Congress to sign on again. And for those who hadn't signed on in the previous Congress, we asked for their support of this bill. And what that means is they just sign on as a co-sponsor, and the more co-sponsors we can get, generally the more attention the bill is going to get in committee, and we can actually move things along if we get a lot of sponsors. NKF will also be announcing a new bill any day now that will increase access to home dialysis. COVID showed us a lot of things about what's going on in the healthcare world, but the importance of access to dialysis at home was very pronounced. Certainly, dialysis centers took all precautions to keep patients and employees safe, but dialysis patients have very low immune systems, and if they're able to do dialysis at home, they should have that option. So we're going to be introducing that bill shortly, and as soon as there are bill numbers, I'll be posting on the Facebook page to let you know what those are. I also shared earlier at our January meeting that we did last year pass the immunosuppressive drug bill. It was signed into law as part of the year-end reconciliation bill. And I do have a mistake on this slide because I say the most recent COVID stimulus payment was included in that, and that was actually the December payment. The most recent ones are the ones some of you just got this weekend. Mine's supposed to hit my bank tomorrow. But we're very excited about the passage of that bill. Recipients like myself have to be on immunosuppressant drugs for life, and currently Medicare covers you for 3 years following transplant. And we do have a number of kidney patients who, because of either poor insurance or no insurance, have trouble covering those medications. And if they choose not to take those or try to take reduced dosages to save money, they can lose their graft. And it obviously saves money in the long run for the Medicare program to continue to pay for those drugs, because having to go back on dialysis is much more expensive than having a transplant. So that was a huge win for last year. And what that would do for me, for example, I do have coverage of these drugs under my employer-related health coverage, but if I were to lose that job and therefore lose the insurance, I would be able to go back on Medicare and continue to have coverage of those immunosuppressants. And though, by the way, those can cost thousands of dollars a month. And let's see. Oh, and there was also an executive order that was signed by President Trump, and that remains in effect at this time, which increased access to home dialysis and made more kidneys available for transplant. It is unlikely that the current administration will act to reverse this order, or that the order will be challenged in the courts, so that should stay in effect. And the next slide, please. So I know this is small print, but our other ask was asking for money. And that's probably the hardest thing for me to do. I'm perfectly comfortable sharing my story and talking about how important the Living Donor Protection Act and the Cares for Home Dialysis Act and all of these other things are. But when it comes to asking for money, that's a challenge. But I did it. I was the one that had this ask for these meetings. So basically, we're asking for members of the House and Senate to approve more money in the federal budget to go to various agencies such as the National Institutes on Health and the Center for Disease Control. And that would support kidney research and also support programs for identifying those with kidney disease so that early changes in lifestyle can be implemented. For most of us who have kidney disease, we can't usually reverse the disease process, but there are lifestyle changes that can sometimes slow the progression of the disease. And that can stave off dialysis or transplant. And that's currently the only two treatments for kidney disease, end-stage kidney disease. Early detection is very important since current estimates are that 1 in 3 people will have kidney disease. And I've been doing a lot of Facebook posting during the month of March because it is Kidney Month. And there's a 60-second quiz that folks can take to determine if they're currently at risk for for kidney disease. So that's something we can all do. And then next slide, please. So I've put on the contact information for our 2 senators, and this is how you contact them to give feedback. So I'm gonna have everybody stay on this slide for a while, because everyone in Wisconsin can contact both of our senators in terms of supporting the Living Donor Protection Act and talking about this other new bill that is going to be introduced. And if you use these links, you're just filling out a form. So all that you do is tell a couple of sentences about your story, what led you, for most of you, to be a living donor, and why these bills are important to you, and then ask them to co-sponsor the bill. So it's usually, maybe 10 sentences at most. They have their own forms, or you can email them if you can find their email address. That's why I wanted to include these links, because it's really, if you click on these or type them into your search engine, it's going to take you right to the form that each one of them wants to submit. And if you have a phone, take a picture of this slide as well. That's a little easier even than writing them down, especially when we get to the next slide, which has all of our House districts and their contact information. If you don't know what district you live in, go to house.gov, house.gov, and in the upper right corner of the screen, you type in your zip code, and sometimes you'll need to do zip +4, depending on where you live, and it will take you directly to your representative's website, and then you have to poke around a little bit to find the Contact Us. But if you use these links, then you'll be able to connect directly to the Contact Us piece of their pages. And again, it's a pretty simple contact form. You fill in your information, you ask them to support the bill. It's easier for them if you do include that bill number. So again, it's S377 and HR 1255 for the Living Donor Protection Act. And then I'll let you guys know when we have a bill number for the Care for Home Dialysis Act. The Kidney Advocacy Committee, again, would love to have an advocate in every district, because you can see the names of the people that we did not meet with. And if we have somebody who lives in that district, it's much easier to get an appointment with their office. So anybody who's interested in doing that, contact me or contact NKF Wisconsin, and they'll direct you to me, and we'll get that coordinated. And then again, a reminder that March is National Kidney Month, and you can use that in your social media posts to bring awareness to kidney disease and the need for donors, whether they be living donors or signing up to be a donor upon death. And at this point, if anybody has any questions for me, I'd be happy to take them. Otherwise, we can go to the next presentation. And I'm going to go off camera, but I'm still going to be here.
Excellent. Thank you so much, Sarah. I'm checking the chat. There aren't any questions currently, but I'm going to give the shout out again to post your questions in the chat. If you're joining us this evening on Facebook Live, please type your questions in the comment bar there, and we will ask them at the end of the presentation.
I just want to say great job on that presentation. The government work and the legislative work that we do, that our advocates do, and the National Kidney Foundation is enormous. The funds and the awareness and the benefit to all that suffer from chronic kidney disease, diabetes, and so forth. And of course, the need for organ transplantation is just tremendous. And it's one of the most important parts of nonprofit work is advocating to our government for more funds to fund NIH and support and research. So great job on that, Sue.
Excellent. Thank you so much for that. I am up now to introduce our guest speakers this evening. Before I do that, I'd just like to share a little bit about myself. I am a co-chair with Jill for Living Donors Together of Wisconsin, and I am a living donor, donated to the father of my best friend from high school a little over 6 years ago. Life is going very well for me. I drink a lot of water. I think that's the biggest difference in life between one kidney and two. So you often see me walking around with this in hand. But honored and thrilled to be joining you this evening, and thank everybody for connecting with Living Donors Together of Wisconsin for how it makes sense for them. If they're interested in education, if they're interested in advocacy, if they're interested in just connecting and knowing that there's a resource for them in Wisconsin. That's ultimately how Jill and I thought of this idea all those years ago and came to partner with the National Kidney Foundation, because we just were looking for a place to find and connect with other living donors. And through that, there's just such a beautiful community of people that we have met and are thrilled to continue to meet along this journey. So as Jill mentioned earlier, join the Facebook group, connect with the National Kidney Foundation, get involved, volunteer, find the ways that matter for you and how you want to stay connected in your living organ donation journey. And with that, thrilled to introduce our guest speakers this evening. It was fun when I was promoting tonight's event and reaching out to people in my network, and they were like, "Oh, she is great. Oh, what wonderful people to be advocating and telling the story for the need to create awareness about living organ donation and transplant, particularly in communities of color." And so with that, thank you. And I'm going to, as a living donor and somebody that has been involved in the community for so long, it's so great to make these connections and to see how there's such a large community, not only locally and regionally and nationally, making a difference for transplant and organ donation. And so with that, I would like to welcome Tonnie Boston, who is the Community Outreach Manager at Versiti. Versiti is a national leader in innovative blood health solutions. She leads the strategic initiatives to create awareness, education, and advocacy opportunities for organ donation among underrepresented populations in Wisconsin. And what I love about Ms. Boston is wherever there's a door to open, whether that's in the faith community, government, schools, media, other broader communities like Living Donors Together of Wisconsin, she is extending the life-saving gift of organ and tissue donation. And outside of Versiti, she volunteers on various committees within the community and is a dedicated member of the Alpha Kappa Alpha sorority. So we thank you for being here this evening, and joining her is her special guest, a Versiti advocate, Stacy Cruthers. And Stacy and I learned that we work together, and we both now work remote. And we miss the pleasures of seeing each other in the office, but thrilled to make the connection here virtually this evening. So with that, I will turn the presentation over to our guest speakers.
Thank you so much, Michelle. That was such a nice introduction. Like she must be talking about Stacy, because she couldn't be talking about me. But thank you for having us this evening. Can everyone see my screen?
Yes.
You're good. Okay, great. I am so excited to be here with everyone this evening. Thank you so much for the invitation. I don't really have much to say that would be as important of what Stacy has to share tonight. So I'll just do my little thing and then bring her on for the impact of her life-saving story. So again, I am the community outreach manager at Versiti Organ and Tissue. I've been there now for more than 5 years. And when I was brought on, I specifically was dedicated to outreaching in the African American and Hispanic communities. So the outreach targets, again, those specific communities. Within those communities, our concentrations were on high schools, colleges and universities, the faith-based community, as well as businesses. So we have, different programs that we use as tools to really reach into those different parts of the community with the education and awareness around organ and tissue donation. Now, most of the time when I'm out educating, it's on deceased donors. But we do touch on the topic of living donation as well. And when I was asked to present tonight, one of the things I was asked to do is share some of the myth busting that we do. And I really don't like to go into the myths, because I don't I don't like to give them air to breathe. I really try to cut them off at the knees. But a lot of our work is myth busting. We hear things like, if I'm a registered organ donor, if I'm in a critical situation or a car accident, and I'm African American, they're not going to save my life. They're just going to want to get my organs. We hear things like, as Black people, we have been raised and taught from generation to generation that, this is something that we just don't do. We don't give of our organs. We don't give our body parts away. You hear things like, when I die and go to heaven, I want to go whole, so that eliminates me from being a donor. You hear things like the medical system is against African Americans. And we do know that, there is some history that exists that is not that positive around African Americans. But, my response to that is that, we should know our history, and there were some unfortunate things that did happen to us as African American people, but we have to learn to reflect to connect, and don't reflect to neglect. So that's my constant reminder, as I'm out doing this education and awareness across the Milwaukee community. So I also wanted to take this opportunity to, share just how we outreach in these very unique communities. So I'll start off with just 2020. I know the year 2020 has been kind of off the wall, right, for everyone. And it was no different for us, you know, as Versiti, Organ and Tissue. And one of the things that, you know, we tried to do early on was to pivot in this virtual environment that we were all placed in. And one of the things that, you know, we continually said to ourselves is that, you know, in this time where people are stuck at home, you know, people are getting sick with COVID, many people in the African American unproportionately were affected by COVID, as well as in the Hispanic community. A lot of the places that we went to for upliftment and spiritual support for a while just no longer were active. You know, a lot of our churches had to figure out how to rebound, right? Had to figure out how to go virtual. That was not something that was already being done. So, you know, we had to take the time in the African American community to really figure out, right, how to be viable and be virtual. So one of the things that we tried to do in our community outreach was to be a supporter of the community and not necessarily be out trying to drive registrations. That just was not our focus for a few months. And so when I say that, you know, what consisted, you know, in that time was we would do email campaigns, just reaching out, you know, just trying to get a feel of how our churches were doing. So we have a program that's called Churches for Organ Donation Education and Registration. The short name is CODR. And we have about 22 churches as part of that program. And so, you know, we would reach out to each one of our churches, you know, by email if we could. We would call our pastors and just say, hey, you know, we're checking in. Is there anything that we could do? We would, we have great partnerships with some of our radio stations for that is specific to the African American community. So like V100 and 98.3, and they were very gracious partners to us. And so they, you know, let us run PSAs, and, you know, so we were doing that on rotation. In May, we just, like I said, we just, all the month of May, we just checked into every one of our churches, every one of our, you know, CODR participating businesses. And that's what we did for a few months. And then our Summer of Love campaign last year was our first big campaign that we did. And we did that in July and August. In that, we tried to keep it simple, but we tried to keep it informational and significant. That simple but significant. That was the motto that we kind of went by. And so we started to re-engage with the community through webinars, which I'm sure a lot of us tried to do. But ours were just really ask me anything, you know, just come to the webinar, sign on, you know, it's casual. It's just the opportunity to be in front of one another. We will have a panel there. Here are some of the people we had on one of our panels during that month. Dr. Pearson, a abdominal surgeon from Freighter, one of our outreach specialists in organ and tissue donation, our manager of tissue services, and then we had Representative Myers, who shared her testimony as a kidney recipient. And really, we just took the time to filter questions that people had around organ and tissue donations. And those were some of the best webinars that, we had ever done, right? Because it really gave people just the chance to just carefree ask what it is that was on their mind about organ and tissue donation. And that really is the way that we do our outreach in the community. That's how we host our education sessions when we go into the churches. They told us, we want to hear from experts. We like you, Miss Community Coordinator, but we want the experts at the table. We want to be able to ask them questions. We want to do that in our environment so that we're comfortable in doing that. And so that's what we do. We have panel discussions. We bring experts who do the work every day. Some of our doctors join us. We have our volunteer ambassadors who join us. And we literally just let the audience lead, or the congregation, lead that discussion. Also, during our pivot, we were able to observe Minority Organ Donor Awareness Month. We had several billboard campaigns that were up, as well as social media. And we had a influencer campaign going on the radio station with that targets the younger African-American community, that is V100. So we had Reggie Brown, who was an influencer for a full month and a half, where he did different segments on organ and tissue donation. And so that's what we did, when we pivoted during this time of COVID. One of our other big significant events was the Seat at the Table webinar series that we did in November. This was in honor of Donor Sabbath, which I don't know if you guys are familiar with you're familiar with Donor Sabbath. So one of the things that we do every year for Donor Sabbath is have a gospel concert where we bring a national performing gospel artist to the city, and we make that free to the community. And we build all of the concert around educating on organ and tissue donation. And they have been very successful for about 4 years straight, obviously, until COVID hit. And so this year, we had to do something a little different. So we did what is called a Seat at the Table webinar series. And this was really significant and unique. Again, so my role is to figure out unique ways to bring this kind of education and awareness to our community. So we hosted webinars, but we really let our community leaders do their thing in leading these webinars. So we have, one of our pastors who led, a webinar. We have one of our important media individuals who led a webinar, and we had one of our important and successful DJs lead the webinar. So, it's kind of unconventional for, a DJ who's doing these virtual house parties and things like that to be leading a webinar around sickle cell. But, that's what we do. We try to reach out deep into the community and establish those relationships, and then really let our community lead us to, where the opportunities are. And so with this particular A Seat at the Table, we had 3 webinars that were each built around a movie. The first one was built around the movie Spilled Milk, which is a documentary about the life of a person who deals with sickle cell. And so the conversation, and then this was opened up a little bit more to go just outside of organ and tissue donation. We really talked about health disparities facing African Americans. So again, the first webinar that we did was around the conversation of sickle cell and bone marrow donation and care. The second one that we did was around organ donation, and the movie we featured was A Question of Faith. And then the third one was around health disparities, again, overall, and we featured the movie, The Immortal Life of Henrietta Lacks. So all of the conversations kind of pulled in what was happening in those movies, as well as what is happening in real life, right? And then, we were able to have some of the movie producers, as part of the webinar to really share inside information on, how the movies were developed, what were in the mind of, some of the directors and actors as all of, these films were being created. So it was really unique and inspirational at the same time. Ways that we promote is probably ways that most people promote. We do social media, mainly Facebook, Twitter, and Instagram. We were able to be featured on a podcast to talk about our Seat at the Table webinar series. And then we do traditional media as well, like radio, websites, and then email and newsletter distributions as well. So we're gearing up for a very unique 2021. One of the things that we'll be doing this year, and that is by way of generous donation from Donate Life Wisconsin, I have to make sure I say that, is an art exhibit that is based on the importance of organ and tissue donation. It will feature a partnership with the Divine Nine, which are the 9 African-American sorority and fraternities. And it will feature an ambassador from each one of the sororities and fraternities who has a relationship with organ and tissue donation. So they could be a living donor, they could be an organ recipient or tissue recipient, or they can be the loved one of a organ donor. And their stories will be featured in this art exhibit, as well as commissioned art pieces from African-American artists within our community. And this will be a traveling art exhibit. We've partnered with America's Black Holocaust Museum to launch this on April 30th, which will be a part of Donate Life Month. And so we are super excited to bring this to the community, and we're hoping that it sparks conversations and, again, unique opportunities to talk about and share the importance of organ and tissue donation. And just some of the things that we're concepting here. So you guys are getting a sneak peek. Nobody has seen this, but some of the things that we're concepting here is really being able to speak to some historical points and how African Americans played a part of that, in the field of organ and tissue donation. Obviously, we will be sharing important stats and facts that relate to the African American community. And as I said, we will certainly be sharing those individual stories from our Divine Nine ambassadors, which the next person that you will be hearing from is one of those Divine Nine ambassadors. So this really ends my portion of the presentation. But probably before I open up for questions, I would like for Stacy to be able to share her testimony. Let me just stop sharing for a second. There we go. Okay. So, Stacy is one of our Versiti Code R advocates, and she's been working with me now for over a year. And I'm so happy to have her. She's my new ideas person. I like to bounce all of my new ideas off of Stacy. And Stacy makes a living as a system business diversity manager at Advocate Aurora Health. She knows the pleasure and the pains of being a mother of twins, as I do. That's another reason why I love Stacy. Stacy is a Harley girl, and she is just an all-around great person. And so what is most significant though about Stacy is that she is here today because of a kidney that she received from her living donor. So without further ado, I would like to introduce Stacy Cruther.
Thank you for that warm welcome. You guys are so good at that. Make you feel fuzzy inside. But yes, so thank you for including me, Tonnie. Thank you for allowing me to be a part of this platform that's focusing on kidney, organ, living tissue donations. It's a privilege, so please know that I recognize it as a privilege. The fact that I'm here is a blessing, and I don't bite my tongue about that. My name is Stacy Cruther, and I am a kidney recipient from an amazing woman named Barb. Just to give you a little bit of my story, we had, I regularly go to the doctor. I don't smoke or drink. I live a somewhat healthy life. You know, the doctor always says you can lose weight, but you know, we won't worry about that one. And so when I found out that something was going on with my kidneys, that was really difficult for me to comprehend. I am a thinker, I am a learner, and I just really couldn't wrap my mind around the fact that I know so many other people that live different lifestyles, and I by no means judge them. But some of those things have been associated with damaging, you know, organs within the body. And I didn't do that. So it was very difficult for me. I had a nephrologist that I was seeing, but after a while, our common routine conversation started to change. And we started talking about dialysis, or if you get to this point, then we're going to have to start talking about dialysis. So no one in my family has had a transplant. It wasn't a part of our conversation growing up. So it was fairly new to me. When it came down to me having to really have some real talk because I had fallen below a certain level for kidney function, that was very difficult for me. I am a wife, I am a mom, I am a daughter, I am a leader, very engaged and active at my church, in my community. And this was something that I really could not comprehend. And I've told my story before, and I've shared that if I could articulate it this way, I felt paralyzed. I didn't tell anyone. I didn't tell my husband, who we've been married, you know, at the time it was over 15 years, because I was just that paralyzed. And I felt like I would be faced with too many I don't knows for me to wrap my head around my situation. So I felt alone, and it took me a while to share where I was. And I had a coworker who I worked with, and I tried my very best to keep my professional life professional, especially with me having the position that I had. I just was very cordial with everyone, but I did not necessarily, go to their homes or, those things. I just tried to keep it professional and have a great working relationship. When it got to the point where they were telling me that I needed to consider dialysis, or for that matter, consider taking a class about home dialysis because I was working, and it was something that would have potentially worked better with my activity and having children and things like that, I was very reluctant with that. So I did eventually tell my husband, and I did eventually share with the inner circle of my family. And what I decided to do was I had a family meeting with the very, very, very closest members of my family, and that did not include some of my immediate family members. I think it's very important as you are working in the community to recognize that the way you introduce your situation, it does make a difference with the outcome. If I feel like I don't have an outlet, if I feel like I'm pressured, then people don't open up. And I was willing to just sit there and see what happens, because I didn't know what to do. And I knew the people around me didn't either. But after I had the meeting with my family, I needed to set up a network for my husband, a support system for my kids, and some way to help keep my family going when I was not able to. But in the process of doing this, I think I was around I had, I don't know, maybe 17% kidney function. I was still working full time, and I still had days where I was on call for 24 hours. And during lunch, I would go to my car and take a nap, and I worked 15 minutes from my home, and it had gotten to the point where I would need to take a nap between home and work, just for a good 5 or 10 minutes. It had gotten out badly. But I had a coworker who reached out, and she was very nice. And she said to me, hi, I work at the Y, and I've heard that you do great things with your church and with the children and youth at your church. I think you'd be great to work at the Y with me. And it wouldn't be long. And it would probably be 2 hours a week, for 1 day a week. And it may not seem like much, but for someone who's taking a nap on the way home, I said to myself, what is she asking me? I have no idea. But in essence, she had no idea that I was sick, because it's not always what you look like, when you could have some serious things that are going on inside. And so she ended the conversation by saying, and on top of that, it seems like you're a person with strong faith, and I really like to know more about the God you serve. Now, how do you end a statement like that and say no? So of course I said yes, and so we got to know one another. And she became, a strong believer, and they got married in 2016, and I was a part of their wedding, and it was very, very special. And even at that moment, I had not told her that I needed a kidney transplant. And one day we were at work, and I just went by to let her know, because I had to sign up for a different course, and it was about understanding about transplants, like what is it really? And I would not be able to come to work that evening, and she was very, very bothered by this. And I do not share personal information at work, as I shared that with you. And she was very adamant, why can't you come? This is our day, why can't we come? And I just said, I have something to do. And there was a small voice inside that spoke to me and said, tell her. Now, to this point, I've only told my immediate family. I did not give the number to anyone. at that moment. And I said to myself, yeah, God, right, because you know I don't do that. And she kept talking, and then I heard the voice again, as clear as if you were standing right next to me, say, tell her. And so I finally told her, and I said, hey, I really am sick, and I'm going to need a transplant, but there's some classes I need to take to help me understand what's truly going on. And immediately she looked at me, and it took a minute, and she said, I'll do it. And I said, well, hang on. I think that's really kind of you to even consider me in such a life-changing, experience. Thank you for that. But no, I won't give you the number. I wasn't saying it to ask you. And and I just wanted to appreciate her for doing that for me. And she said, no, I'm going to do it. And then so eventually I did not give her the number, but the next day I had a thank you card for her for considering me in such a life altering, position. And in the thank you card at the bottom, it was sealed, but in the thank you card at the bottom, I wrote the number for her to call to see, if she would qualify. And when I approached her with the card, she said, I don't want your card unless you give me the number. And she was very adamant about it. And I said, the card has the number in it. And I said, but I tell you this, if you do decide to go and get checked, don't tell me. Don't tell me when, don't tell me anything about it. You might discover something about yourself. There may be something that your husband and you feel, is too serious for you to move forward. And I don't want our relationship to be weird because it's too special to me. So if you go and you just keep it to yourself. And she said, okay, fine. And all the while we were working, she went the very next day. I didn't know. And shortly after, my kidney functions had dropped below, I think, 11. I had a kidney function of 11. And the hospital had been calling me to go and take the training for home dialysis. And the first time they called me, I was very angry about it, and I did not answer the phone. The second time they called me, I did not answer the phone. But the third time I had made up in my mind that I was ready to see whatever the next phase was. And my faith had become strong enough for me to know that with the Lord's help and the support of my husband and my family, that I was going to be okay. And I had the courage to answer the phone. And unfortunately, I answered the phone with an ugly attitude. I pressed the speakerphone button and I said, okay, I'm ready. I knew who they were calling. I knew where they were calling from. When do you want me to come? I'm ready. And then the voice on the other side said, I'm just calling to congratulate you because we have a perfect match. So it turned out that there was the education team that was calling to schedule me for my transplant. At the same time, the transplant team was calling to schedule me for the final assessments. And they happened to have my donor on the other line. And they told us both at the same time because she really wanted me to know. I share my story to just admonish people to listen to the small voice that's inside. It turned out that she had been waiting to make a significant donation of some sort because her mom passed away and donated her tissue and her organs, but she only wanted to do it with someone who she had a relationship with. And I think about all of the what ifs and all of the no's that I put in front of my own self that would have blocked me from receiving such an amazing blessing from a woman. So as you reach out into the community, please encourage them to listen to the voice they have inside. I was blessed because when I had the courage to speak out and say what my situation was, there was support that was there for me, and I did not have to struggle alone. And as you're working with different groups, continue to tell yourself to meet them where they are. I don't feel I'm an educated, college educated woman, and I consider myself to not be a dull knife in the drawer. But when it came to that, my goodness, it was just so new for me. So I encourage you to be patient. I think her and her family, we're still very close to this day. That's just my story. I'm sure there are a number of other stories, but I hope it helps someone to reflect and think twice and not necessarily go with what the group is telling you to do, but in all sincerity, just listen to the small voice that may be speaking to you that's saying, yes, do this. Thank you.
Absolutely beautiful. I'm over here tearing up. Can't find my unmute button, all the good things. Thank you so very much for sharing that personal and real story. As I was saying in the comments, real. And that's what this program and these presentations are all about. Real stories, real people, and in sharing those raw moments of what it's like to be on both sides, the recipient and the donor. And I was going to put in the chat, I often get asked, as a living donor, I often get asked from hopeful recipients, like, what was it in the story that you heard that made you say, yeah, sign me up, or, oh, I'll go get checked out. Because what you reminded me of tonight is the recipient journey and that wave of emotions that you experience. For those watching, as I get goosebumps, what else would you say to those recipients, those hopeful recipients that may be watching this evening? Anything else to add about telling their story, or ways to tell their story, platforms to tell their story? Anything else you would add, Stacy, for those recipients?
Yes, so I would say not to beat yourself up. I would also say that you are not alone. I went to a course about transplants, and they were sharing different ways that people got the word out. You know, one person held a sign up and one person did something on Facebook. Do whatever you feel you need to do to convey your message. And if you don't know what to do, then reach out to those who you trust and bring them with you when you're getting some information. Sometimes when you hear what you need, you can become audibly like, you can't hear, I can't move past what you said. But if you have someone there with you to help digest it afterwards, that helps me forming a circle with my family to kind of talk it out, because I was stuck on all of the what ifs and what ifs and what about that and what about this and that. I would say do that. You don't have to tell everyone because you don't want people to start acting weird, but do develop your own circle of folks that you trust, and you have some agreement that we're going to bring some people in so that we can be armed with tangible, smart things that have worked.
I just want to throw in that the National Kidney Foundation at kidney.org has a program called The Big Ask, The Big Give, and it helps recipients work through the process of how to share their story and how to ask people to become living donors. And that can be a tremendous resource because I can so relate to Stacy to start having those conversations of, oh, by the way, I need a kidney. How are you feeling about that? You know, it's such a difficult thing to ask people to do. And those of you who are donors are like, well, I heard the story. I felt that, you know, I was led to donate, and that's great and wonderful. And thank you for that. But as a recipient, to ask for that is so challenging. So kidney.org has this Big Ask, Big Give program. And I do recommend that if you're going to talk to people about resources, that's a great one.
I agree with Sarah. I'm on the board of advisors for the National Kidney Foundation of South Dakota, North Dakota, Iowa, and Nebraska. Now they just extended our region, but we just did one on Sunday. It's our fourth one. This one was virtual, and just we're shocked how many people are coming and finding out things that other ways to ask for a kidney. We do programs that called Your Kidneys and You. So one of the girls she's a college student. We came up with a plan to come into her class and present that. And then at the end, the professor said, by the way, one of our students needs a kidney. So she didn't really have to do it. She wasn't comfortable at first. And then her and her mom got way better at that. And that was just our way of teaching other people about kidneys and then asking for that she needed one. So it was kind of connecting both them programs together. But you're right, Sarah, it's a really good program.
Thank you, Deb, so very much for sharing that. And it's good to hear what other resources are available across the Midwest and country. So thank you for joining us this evening from you're in South Dakota, correct?
Correct.
Excellent, wonderful.
73 yesterday or day before, blizzard when I woke up. So yeah, Midwest.
Exactly, exactly, right?
Yeah.
That in common. Again, we encourage you to post questions or comments in the thread. I am monitoring our Facebook Live to see what might be coming in there. And I believe Jill had a question and comment to share.
Yes, two things. Stacy, first of all, I too had the voice that you had, and my story is long and complicated, so I won't go into it, but I actually, in my office, I was in my office, I'm an optometrist, and I was in my office, and one of my patients actually told me that he needed a kidney, and I heard the words as though it was somebody was standing next to me say, tell him you'll give him one of yours. And so I did, and he did the whole, like you did as a recipient, like I couldn't ask you to do that. And I said, you didn't ask me to do that. I've been basically told to do that. And I also then later on in my story had that feeling when I had to tell somebody, which led to my ultimate recipient. But I love your story. I absolutely love your story. I just think it's fantastic. And I think it's so important that what you basically brought out is the importance of telling your story, because you weren't going to tell anybody. And, we talk to living donors all the time about this. And, one thing I hear from living donors a lot is they say, well, I don't want to brag. I don't want to brag about it. And I say, you're not, shout it from the rooftops. You're not bragging. You're sharing this so that we can get more donors. We can bring more people in. And so that's one thing that, same thing that we can say to recipients is, shout it from the rooftops, because the more donors we can have, the less people that end up on the list and the more kidneys that get transplanted. So thank you so much. I absolutely love your story. And Tonnie, I had a question for you. At the very beginning of your talk, you mentioned that in the Black community and the African American community, that in general, you said, I think that you didn't really, that it just wasn't something that you did. Now, is there a reason for that? Was it a cultural type of thing? I know you pointed out a couple of things about, being afraid that maybe the doctors wouldn't save you, but do you feel like it was more of a cultural thing that just was passed down from generation to generation, or do you think it was, do you know what the real underlying reason for that was?
About why people in the African American community say that's something that we just don't do?
Right, yeah.
So I would say two reasons. One, because that kind of thing does get passed down, from friend to friend. But I think the ultimate reason for that is the lack of education. The opportunity to get this kind of education is just not readily available. And I always like to use myself for an example. When I came into this role, I was not a registered donor. And it wasn't because I didn't believe in it. I don't think anyone had ever told me that this is something that we don't do. It's just that I didn't know. And I was a college educated woman. I feel like I'm an open-minded person. I just never was met with the opportunity to learn about the importance of organ and tissue donation. Blood, yes, we talk about that in school. I attended blood drives in school, but organ and tissue donation, it was just never talked about. So I think that it's the lack of education, and moreover, the lack of opportunity to get the education. And so that's why, you know, I feel like that's the most important thing that I do in my role, is I create the opportunities to get the education.
That's great. That's great. It's just as though, you know, you took what you knew was lacking and turned it into education. I think that's fantastic. Good for you. Good for you.
Well, again, thank you so very much for being our guest speakers this evening. We learned a lot. We learned about new ways that we can connect and educate and hopefully inspire people to learn more about organ donation. And Craig made a great comment. It's not only about donating life, it's about love and connection. And I'll definitely be taking that away from this program this evening. So thank you again for being our guest speakers. With that, I would love to turn it back over to the National Kidney Foundation Executive Director, CEO, Michael Crowley.
Okay, sorry about that delay. Well, thank you very much, Tonnie, and thank you, Stacy. Very inspiring, very real, heartfelt messages, and it was great to listen to you, and we really appreciate your time this evening. With that, we'd like to ask those who have participated and joined us on Facebook. We have a program evaluation survey to let us know how you like this evening's program. It's at thesurveymonkey.com. You'll see the link there, and we'll be on Facebook. And then the next slide. Our Living Donors Together Wisconsin was created by Living Donors. Thank you, Sarah. Thank you, Jill. Thank you, Michelle. It's created by Living Donors for Living Donors. We keep current on trends in living donation through awareness, networking, opportunities, and education, and we're dedicated to inspire and to save lives in Wisconsin and throughout the country. Please join us on Facebook for the groups. Follow us on Facebook, Living Donors Together. There's a private Facebook group, and we'll go to the next slide. And then tonight's presentation, there will be a recording of it and the PowerPoint slides that were shared, and you'll see the link there. And my closing remark is, once again, I am inspired and enlightened. I'm a sponge. I love to learn, and I'm learning so much from real living donors and recipients. And being a new CEO of a nonprofit such as the National Kidney Foundation of Wisconsin, it really is about people and wanting to make a difference in life. And you know, I found my purpose here. You've all found your purpose, and people reach out to you and want to help you. That's what life is about. And just very proud and happy that I am with you again this evening, and I look forward to the next meeting. I will turn it over to Michelle for any other closing remarks. Thank you.
Wonderful. Thank you everyone again for being with us this evening. This was our last program for Q1 2021. We will be working with Michael and Susan to plan future Living Donors Together of Wisconsin events, but that doesn't stop us from commenting and sharing on our Facebook group. So definitely check that out, Living Donors Together of Wisconsin. Jill and I and Sarah and many others post there often, and always look forward to connecting and gathering on the social platform. It is Kidney Month, and we are approaching Donate Life Month. And so we encourage you to act, tell the story, volunteer, give of your, as we say, talents, times, treasures, all those great things. As cliche as that is, it still works. Get involved, and together we will continue to donate life and share that great love that was talked about on tonight's program. So with that, have a wonderful rest of your evening. Go whatever team you're cheering for, March Madness, because there's a few that aren't there this year. But my alma mater, Grand Canyon University, is there. So go Lopes, and we look forward to seeing you at a future program. Good night, everybody.
Thanks, everyone.